Hey, good morning, you two. You know, who doesn't have a pain in their neck or their back from driving to work, sitting in Houston traffic every day, or you've got a desk job, you have to sit at the desk, and just the stress and the typing, it gets to you. Well, this is one of the first places I've found in the area. It's in Katy, Medical Fitness Pros, where they work on those issues. You may not even need surgery because that's how they treat those things. So I want to introduce you to Jason Hodge. He is the founder of Medical Fitness Pros. And Jason, you have a physical therapy background, you were telling me. That's kind of how you got into this type of business. But tell me about your certification, what makes your facility different compared to, you know, the gym down the street.
Sure. Basically, we have medical exercise specialist certifications, and the idea is to understand medical conditions. We have about 62 different medical conditions we go through training for, and we work with the client's medical provider, either a doctor or a chiropractor, physical therapist, and create a program that's going to be safe for them.
So this isn't just like, you know, you go to the hospital, you get physical therapy for a surgery you had. I mean, this is actually trying to prevent, you know, like a back pain or something from leading to surgery.
It's a combination of things. Sometimes it's prevention, and sometimes it's after they get discharged from physical therapy and more of a post-rehab personal training.
Okay, so I want to introduce you to Paul. He is one of Jason's clients, and Paul is relaxed here on the mat. He's working with Graham. And Paul, I heard that you had 4 spine surgeries, still had pain. How were they able to help you here?
Well, it started out slow, just getting everything working again. And now I'm back to where I was before I had any surgeries.
And you couldn't ride the lawnmower even. I mean, that was hard for you to do. Lawn work, to hunt?
I couldn't do anything. Pretty much took away my life, and now I have it back.
And how long did you work before you were able to see a difference with the pain you were having?
About 4 to 6 months, somewhere in there.
Okay, so that's a reasonable amount of time. And I'm going to have Jason explain some of the exercises that he was able to do with Paul to kind of help with that pain, because maybe this is something that you're struggling with at home. You want to get started today. So tell me what you did with Paul.
Well, the very first thing we did was just strengthen the 2 most important muscles when it came to his lower back. We wanted to get the core stronger and the glutes stronger, the butt muscles.
Okay.
And so we started with something simple like a bridge. And basically the bridge, we wanted to get him to learn how to activate the glutes or the butt muscles better and get that stronger while he still maintain good core stability.
And when you say core, you were explaining to me that isn't about your abdominal muscles so much as it is your spine.
Right. Well, yeah, I mean, it is the abdominals around the whole body, but it's your body's ability to control the spine with your core muscles. So when you're doing exercises, not allowing the back to move into its own position, but be able to hold it steady as you perform the exercise properly.
And you call this functional movement, right?
Right. Well, yeah, I mean, especially for his sake, we got to where we were doing a lot of pushing, pulling, lifting, and carrying, because that's what he did outside. He was trying to be functional outside. And so we incorporate activities that involve that so that he got stronger and was able to perform those activities without pain.
Great. All right. And then, Paul, I have to ask, so did you notice a difference then in the physical appearance as well?
Big difference.
Big difference. There you go. That's the icing on the cake. All right. Thanks so much.